Do you find yourself asking people to repeat what they said, or turning up the TV louder than everyone else? Here is something that will surprise you. Untreated hearing loss dementia connection is real, and it is the #1 thing you can control to prevent cognitive decline. Today, I am showing you why your ears matter more than you think for your brain health, and how hearing aids can cut your risk by 75%. Most people think memory problems come first with dementia, but the Alzheimer's hearing loss connection starts much earlier than that. The 2024 Lancet Commission studied millions of people and found something shocking. Out of all 14 things you can control to prevent dementia, hearing loss accounts for 7% of cases, more than any other single factor. Yet almost nobody talks about this. Doctors rarely bring it up, and most people ignore the signs until it is too late. Today you are going to understand exactly how your hearing affects your brain, what the science really shows, and what you can do right now to protect yourself. When you think about preventing dementia, what comes to mind? Probably diet, exercise, maybe keeping your mind active. But here is what shocked researchers. Your hearing plays a bigger role than almost anything else. The 2024 Lancet Commission report found that hearing loss is responsible for 7% of all dementia cases worldwide, making it the single largest factor we can actually do something about. Why does hearing matter so much for your brain? Because when you start losing your hearing, the parts of your brain that process sound begin to shrink from lack of use, and that damage spreads to areas that handle memory and thinking. A 2024 analysis of 50 studies covering 1.5 million people found something alarming. For every 10 decibels you lose, dementia risk jumps 16%. So how exactly does losing your hearing lead to dementia? Scientists have identified 3 main ways this happens, and when you understand them, it all makes sense. First is what they call cognitive load hearing strain. When you struggle to hear conversations, your brain has to work extra hard just to figure out what people are saying, and that constant effort exhausts the parts of your brain meant for memory and thinking. Second, your brain physically shrinks in the areas that process sound when they stop getting used, and this shrinkage does not stay contained. It spreads to neighboring regions that control memory. Third, and this one hits hard emotionally, people start avoiding conversations because hearing is too difficult. They skip family dinners and stop calling friends, and that social isolation by itself raises dementia risk by 27%. All 3 of these work together to damage your brain over time. Let me show you the numbers that made doctors start paying attention to this connection. When researchers looked at people already diagnosed with Alzheimer's disease, they found that 80% of them had hearing loss, that is 8 out of every 10 patients. Now, here is where the hearing loss Alzheimer's statistics get really specific. Mild hearing loss increases your overall dementia risk by 35%, and it climbs from there with moderate and severe loss. The 2024 meta-analysis I mentioned earlier tracked 1.5 million people across different countries and ages. So this is not a small study. This is solid proof. And here is what worries experts the most. The brain damage starts accumulating years before you notice any memory problems. Some research suggests the changes begin happening a full decade before diagnosis. That is a 10-year window where your untreated hearing is quietly changing your brain. Warning signs. You're losing hearing. How do you know if this is happening to you? Pay attention to these early hearing loss signs because most people miss them until family members start complaining. Do you ask people to repeat themselves more than once in a conversation, or do others tell you the TV is too loud when it sounds normal to you? Restaurants and crowded places become exhausting because you cannot pick out one voice from all the background noise. You might miss the doorbell or not hear your phone ringing in another room. And here is the one that should really make you pause. If you have started avoiding family gatherings or stopped calling friends because following conversations feels like too much work, that is a red flag. Your brain is telling you something is wrong. Not all hearing loss is the same, and knowing which type you have matters for what you can do about it. The most common is age-related hearing loss called presbycusis. This happens gradually as the tiny hair cells in your inner ear wear out over time, and it affects about 1 in 3 people over 65. Then there is noise-induced hearing loss from years of loud environments like factories, concerts, or even lawnmowers without ear protection. Some hearing loss comes from medical issues like ear infections, certain medications that damage hearing, or conditions like diabetes. Here is the important part. Some types can be reversed if you catch them early and treat the underlying cause, but most age-related and noise damage is permanent. That is why early action matters. What you still have is worth protecting. Here is the good news that should give you hope. Hearing aids prevent dementia in a way we can actually measure. A massive Danish study followed 573,000 people, and the results were stunning. People who wore hearing aids had only a 6% increased dementia risk compared to those with normal hearing, but people who needed hearing aids and did not use them had a 20% increased risk. That is a 75% reduction in risk just from wearing the devices. So, why do only 22% of people who need hearing aids actually use them? 3 big reasons come up over and over. Because many insurance plans do not cover them, stigma. Because people worry about looking old, and denial because admitting you need help is hard. But technology has changed dramatically. Modern hearing aids are tiny, some are invisible, and they connect to your phone like wireless earbuds. So what do you actually do with this information? Start with a hearing test dementia prevention strategy by getting tested, and I mean actually schedule it this week. If you are over 50, you should get your hearing checked even if you think it is fine. And if you notice any of those warning signs I mentioned earlier, go sooner. You can see an audiologist who specializes in hearing, an ENT doctor, or ask your primary care doctor for a referral. The test itself is simple and painless. You sit in a quiet room with headphones and respond when you hear different tones and words. Medicare covers hearing tests when medically necessary, so check your benefits. If they recommend hearing aids, actually get them and wear them. Yes, there is an adjustment period where things sound weird or too loud, but your brain adapts in a few weeks. Beyond hearing aids, you need to protect your hearing and brain health before damage happens in the first place. Wear earplugs or noise-cancelling headphones around loud machinery, concerts, or even when mowing your lawn. Noise damage builds up over years, and it is permanent. Follow the 60-60 rule with headphones. Keep volume at 60% and take breaks every 60 minutes. If you get an ear infection, treat it right away because untreated infections can cause lasting damage. Get your hearing checked regularly, starting at age 50, not just when you think something is wrong. And please hear this. Do not wait until your hearing is bad enough to bother you. By then the brain damage has already started and you have lost years you could have protected. Disclaimer. Before we finish, I need to be clear about something important. This video is for educational purposes only and is not medical advice. If you think you might have hearing loss or any concerns about your health, please talk to your doctor or a hearing specialist. They can give you proper testing and advice based on your specific needs. Remember, hearing loss accounts for 7% of preventable dementia cases, and hearing aids can cut your risk by 75%. Get your hearing tested. It could save your brain. If this video opened your eyes, hit that like button and share it with someone who needs to hear this. Tell me in the comments, have you had your hearing checked?